EpiPen and EpiPen Junior auto-injectors should be used immediately in an emergency situation involving a severe allergic reaction or anaphylaxis. EpiPen and EpiPen Junior auto-injectors are not a substitute for emergency medical treatment. Be sure to listen to the end of this video for additional important safety information.
Hi, I'm Dr. Camargo, an emergency physician and expert in the treatment of allergic reactions. One of the first questions patients with severe allergic reactions usually ask is, what causes anaphylaxis? The most common causes are food and insect stings. But anaphylaxis can also be caused by other things, such as contact with latex, ingestion of medication, or rarely by exercise. The next question many patients ask is, how do I know when it's really time to use my EpiPen auto-injector? My answer is simple. As soon as a person with a history of severe allergic reactions comes in contact with a known or suspected trigger, such as a specific food or insect sting, and he or she begins to develop any symptom of anaphylaxis, EpiPen should be administered immediately. Signs and symptoms of anaphylaxis include skin or lip swelling, itching, hives, trouble breathing, stomach cramps, nausea, vomiting, lightheadedness, dizziness, or fainting from a severe drop in blood pressure. It's critical that you don't hesitate to use your EpiPen because a severe allergic reaction can turn into a life-threatening emergency in minutes. After the injection, you'll need to call 911 and get to the nearest hospital emergency room as soon as possible in case further medical treatment is needed. If symptoms of a severe allergic reaction are still present about 10 minutes after the first injection and you haven't received medical attention yet, a second dose of epinephrine may be necessary. Be sure that you always have the EpiPen auto-injector with you because every second counts during a severe allergic reaction.
When you or someone you care about has a severe allergic reaction, it can be really frightening. But being prepared with an EpiPen auto-injector can make all the difference. Most importantly, in the event of a severe allergic reaction, you need to know how to use EpiPen properly. Recently, we were reminded just how important it is to keep EpiPen with us at all times. We had planned a family get-together in the park. It was a beautiful day and we brought a picnic lunch. What we didn't plan for was that Joey's chocolate chip cookie would end up having peanuts in it. Within seconds, he started showing signs of a severe allergic reaction. Luckily, wherever we are, the EpiPen 2-pack is with us. So, just as the directions instruct, I took the EpiPen Junior out of the plastic carrying case. Next, I removed the blue safety release cap from the EpiPen. This must be done in order to unlock the EpiPen. Then, I made sure I had a firm grip on the EpiPen with my thumb pointing away from the end with the orange tip. I then positioned the EpiPen at a 90-degree angle to go into my son's outer thigh. Next, I swung and pushed the EpiPen firmly into his pants until I heard a click or popping sound. I then held the EpiPen tightly pressed against his thigh for 10 seconds to ensure that all the medicine inside the EpiPen was given. After approximately 10 seconds, I removed it. A really important and unique feature of EpiPen is the built-in protection from accidental needle sticks once EpiPen is removed. Once EpiPen is correctly used, you will notice this orange plastic cover extended at the end of the EpiPen. This orange tip is there to cover the used needle, assuring that there is no accidental needle sticks once the EpiPen has been used. Once you remove the EpiPen, massage the thigh area for another 10 seconds. Call 911 as soon as you are finished administering the EpiPen or have someone else call while you are injecting the medication. Be sure to go to the nearest emergency room so that you can receive any further medical treatment that may be necessary. Take the used EpiPen with you. If EpiPen were needed for an adult, it should be administered in the same way. First, remove the EpiPen from the plastic carrying case. Then, unlock the EpiPen by removing the blue safety release cap at the top. Next, grip the EpiPen in your hand with your thumb away from the end with the orange tip. Swing and push the EpiPen with the orange tip towards the outer thigh at a 90-degree angle, making sure you have applied enough pressure to hear a click or popping sound. Once you remove EpiPen, massage the thigh area for another 10 seconds. Call 911 as soon as you are finished administering the EpiPen, or have someone else call while you are injecting the medication. Be sure to go to the nearest emergency room so that you can receive any further medical treatment that may be necessary. Take the used EpiPen with you. We weren't expecting any peanuts to show up in our lunch, but we were prepared with Epipen Junior 2-pack auto-injectors. My son is fine, thanks to Epipen. I'm glad we are always prepared for these unexpected emergencies by having Epipen 2-pack with us at all times. Safety is important, so make sure you also watch the important safety information at the end of this video. Oh, and by the way, another important step we took to prepare for a severe allergic reaction was enrolling in the Center for Anaphylactic Support, also called CAS. Just log on to epipen.com/CAS to enroll, and you'll find out how you can receive the latest information on severe allergies, timely EpiPen refill reminders, and more. Get the benefits of a free CAS membership and other great offers. Remember, you can't always avoid contact with triggers that cause severe allergic reactions, but you can be prepared with Epipen 2-pack. Important safety information. Each EpiPen auto-injector contains a single dose of a medicine called epinephrine, which you inject into your outer thigh. Do not inject intravenously. Do not inject into your buttock, as this may not be effective for a severe allergic reaction. In case of accidental injection, please seek immediate medical treatment. Epinephrine should be used with caution if you have heart disease or are taking certain medicines that can cause heart-related cardiac symptoms. Side effects may include an increase in heart rate, a stronger or irregular heartbeat, sweating, nausea, and vomiting, difficulty breathing, paleness, dizziness, weakness or shakiness, headache, apprehension, nervousness, or anxiety. These side effects usually go away quickly, especially if you rest. If you have high blood pressure or an overactive thyroid, these side effects may be more severe or longer lasting. If you have heart disease, you could experience chest pain, angina. If you have diabetes, your blood sugar levels may increase after use. If you have Parkinson's disease, your symptoms may temporarily get worse.